decades.
Okay, gut. Entschuldigung, die Präsentation eigentlich sollte von Herrn Kombas gemacht, aber wegen Visa-Probleme konnte er leider nicht kommen. Ich kann die Präsentation auf Englisch halten und dann können wir die Fragen oder auf Englisch
machen
oder
Sie
Deutsch.
ruhig.
Ja, okay.
Wir sind internationale Gesellschaft.
Okay, good. So the presentation is about the rhabdomyosarcoma in the United States. The rhabdomyosarcoma, as you know, is the most common soft tissue sarcoma in children and adolescents, with 5% of all pediatric tumors, comprising about 350% new cases in the United States. And the embryonal and the alveolar subtypes are the most common. And it is the orbital ocular one is accounted for about 10% of all RMS. And it can also present in the orbit, or the eyelids, conjunctiva, or anterior uveal tract. In our previous studies that we published 10 years ago, we showed that it accounted for about 2.7% of all orbital cancer cases and affected mainly the age between 7 and 19. And it had a better prognosis than the non-orbital head and neck tumors. And in all the presented studies before, it represented about only 10 to 30% of the United States population. And those studies showed an overall five-year survival of 93%, with no significant difference among subtypes. And we think that this result, that there is no significant difference among subtypes, are usually related to the limited scale and limited number of patients in those studies. So we decided to conduct this study and try to convert the low resolution picture on rhabdomyosarcoma to a higher resolution one. So we investigated the incidence, survival, and characteristics and trends of orbital and ocular rhabdomyosarcoma in the United States between 1996 and 2018, and tried to discern the differences between different races, histological subtypes, and discover disparities between those subtypes. Message to the patients and the guardians about the disease. In 2018, and we used the ICD-03 topographical classification and the young adults and adolescents classification for the histology. And we calculated, good, so perfect. So, and we calculated the incidence rates per million, and we adjusted also the rates to the standard rates in the USA to calculate the standardized age, the age-adjusted incidence rates and the survival rates to calculate the relative survival rates compared to the population. And we used CIRSTAT software for that. The results showed that among 92,633 patients with ocular and adnexal malignancies, there were 640 patients with ocular and orbital rhabdomyosarcoma, about 0.7%, and this represented 4.2% of all rhabdomyosarcomas of the whole body. And mostly they presented in the age group between 0 and 9, with 72%, with a median age of 6 and a mean age of 9. So with this discrepancy between the mean and median, you can imagine the distribution. So it is mainly skewed to the right, with mainly the patients presenting in the first 10 years of age. And males were dominant with about 57%. And the embryonal subtype showed a percentage of about 70%. The orbit was the main site with 93%, and it occurred unilaterally, and both eyes were similarly presented with about 50%. And the most tumors presented localized with 68%, and with the initial distant metastasis in 8%. And there was secondary tumors later in life in 4% of the patients. Compared to a whole body incidence of rhabdomyosarcoma of 2.4%, the orbital and ocular rhabdomyosarcoma showed 0.1% incidence, with males of higher incidence with 0.012. And as you see here, the distribution showed a bigeminal distribution with one apex at 3, one peak at 3 years of age, and one peak at 6 years of age. And actually, this was interesting because it may indicate undergoing genetic factors. The whites showed the highest incidence of 0.1, while the blacks 0.01, 0.09, and the Alaska natives showed the lowest incidence of 0.7. And the trends of the whole body rhabdomyosarcoma showed an increasing trend over the year, with about 1% increase each year. In contrary, the ocular orbital rhabdomyosarcoma showed a declining incidence, with about a decrease of 2% each year. On the treatment side, the chemotherapy was the main therapy of choice with 85% of the cases, and the surgical intervention could be done in 45%. This means that about 55% couldn't get surgical intervention. And the radiation therapy were applied in 67% of the patients. We had the survival rates of 555 patients, and it showed 5-year relative survival rate of 90%, and a 10-year survival rate of 87%, with no significant difference between sexes. However, the age group 4 to 6 years showed the highest survival rate with 98%, while those above the age of 11 showed the lowest survival rate. Whites showed also the highest survival rate with 92%, and the Asians showed a lower, and also blacks. The embryonal subtype showed the best survival rate with 95%, and the alveolar subtype showed a survival rate of 70%, with the lowest prognosis. And this is the first study that shows this, with this high resolution. And the patients with distant metastasis showed the lowest survival of 45%. On the clinical perspective, the conduction of surgery, or conducting multimodal treatment, including surgery, showed to to present the highest survival rates. So here you can see that the multimodal chemotherapy with surgery or chemotherapy, surgical intervention, and radiation showed the highest survival rate, and those who didn't get surgical intervention showed the worst survival. And over the time, there was no improvement in survival over the years. So in conclusion, our study is the first to investigate such tumor in high resolution. The incidence of rhabdomyosarcoma decreased over years. However, the survival remained stable. The ocular and orbital rhabdomyosarcoma accounted for 4.2% of all RMS cases, with 2 distinct peaks of incidence at 3 and 6 years. It showed disparities with low incidence in non-whites and worst survival in this group. And the incidence was decreasing compared to the whole body rhabdomyosarcoma. And the incidence of 7.7 of secondary malignant neoplasms later in life is lower than reported before. And the ability to surgically remove the tumor within multimodal regimen is a remarkable indicator of success. So thank you, and ready for questions.
Thank you very much for this very important data you presented. Very nice. Did you compare it to the results from China? I think they had also a large study, including nationwide rhabdomyosarcoma cases.
So we didn't compare to other. We're focused on the United States. Mm-hmm. So because of the limited number of the Chinese originating population, we couldn't compare to other populations. So we focused on the previously presented data from United States.
And did you find the significance of tumor size towards the influence on survival?
We didn't. The data set didn't include the clinical data on those patients. It is an epidemiological study. Yeah. So we couldn't infer anything about the size. We assume that the site of the tumor is mainly is it intraconal or extraconal tumor? Yeah. Okay. And if it is affecting our adherent to the eye and the optic nerve, is the main factors related to the.
Okay, thank you very much.
Ja. Okay, vielen Dank. Dann würde ich als nächstes Herrn Gutmann aus Berlin bitten, mit seinem Vortrag klinische Ergebnisse des periokulären Merkelzellkarzinoms. Herr Gutmann, Feuer frei.